Hi, welcome to the Medicare Show. I'm your host and Medicare advisor, Jeffrey Kuhn. Today's podcast, which is being recorded on November 5th, 2024, is in regards to HMO versus PPO plans. Today's actually election day. If you happen to catch this, it's probably not going to get published today, but that's when it's being recorded. And there's a lot of controversy, like there probably is with today's politics, and depending on which side of the aisle you're on and how passionate your friends are. This is a topic I get asked on a weekly basis. I think there's a lot of misinformation around. And I want to first disclaim that this is generally true for most areas. Always check, because every insurance company has different policies and they're structured a little bit differently depending on where you are in the country. At minimum by state, also by counties, these plans kind of get bundled together as far as a region goes. And PPO and HMO, I get people that I speak with weekly that are misled and they don't understand the differences when it comes to Medicare Advantage plans. I think in the past, with these plans, or with insurance plans in general, it was true years and years ago about HMOs versus PPOs. And I'm trying to understand where people get this information from. It's not easy to kind of put myself into somebody's shoes when they come in here and go, what's their history been? Why do they come with their degree of bias or opinions on things? And I go, let me start with one of the most popular places people today are looking. It seems to be the utmost authority on all subject matters, and that's Google. So I Googled it, and I Googled PPOs versus HMOs. I looked in a number of different places and see what are people getting for information on this. And I went out to AI, artificial intelligence, and I asked a number of different ways to see what is the information that's out there and kind of accumulated all this. And I put together a couple pages of the information that people are being exposed to regarding PPOs and HMOs. And I want to review it with you and go over the difference between them and what you need to ask and what you need to be aware of. The thing that you typically will see is key differences between HMOs and PPOs. I'm going to go through a few of these things with you. First and foremost, it says HMO plans, provider network. They require members to choose a primary care physician. That is absolutely true. They typically do. Any application that we've seen when you enroll in a plan, it's going to ask who your primary care doctor is. However, even though it's for HMO plans, the PPOs do require that as well. This is the number one thing that people come in with this misunderstanding around. You must get referrals from your primary care physician to see specialists. That is 100% wrong most of the time. If you look at your plans under specialists in any of these HMOs, it states no referrals required. People tend not to read the details, but that's the biggest thing that people think, where they're being misled. And I see this all the time. And I'll tell you in a few minutes one of the things that triggered this podcast. Generally, you're required to use a plan's network of doctors and hospitals for all non-emergency care. Out-of-network care is usually not covered except in emergencies. That's true. Networks, with a lot of the insurance companies, they've got a nationwide network. It's not just a local network. However, a lot of smaller insurance companies do have just a regional network. Now, if you have an emergency, whether it's urgent care or you go in the emergency room, you generally are covered. There's no network in that case. And I get a lot of questions from people that never see doctors or going to vacation a week or 2 weeks, and they're traveling and they're worried, what if they need something? They likely won't. They hardly use anything where they're at. And I always tell people you can go to any emergency room typically in any urgent care center and get care. There's no networks when it comes to that. Unless you're spending extended periods of time and a location you're snowbirding to, or you have a second home, that you have medical care that you need in regular doctors, then we need to look more carefully at the networks that those doctors are in. But for most people, it really doesn't matter. So that's one of the big things with the HMOs. Now, I think what triggered this podcast originally is I woke up a couple days ago, and there's a whole email stream going on one of those network apps that people are in. Somebody realized probably at least a month since everybody's been notified that their Medicare plan is being terminated for 2025. And they're asking people, and they're complaining about everything, whether it's, the government, Medicare funding, prescription drug coverage for next year. and there must have been 90 comments from their neighbors. And I looked up online, I Googled, because the first thing I thought, I hate to say this, is these people are idiots. You know, people are giving advice around Medicare plans who just are very ill-informed. There's, I can't tell you, countless numbers of insurance agents going, I'm a licensed Medicare agent, call me. They're giving information that's not really giving the full picture or what I would call a comprehensive plan around Medicare. And the information is just generally wrong. And it's just the basis of it is not correct because people are saying this or that about this plan I like because of these reasons or this plan. And they're saying just shooting stuff out without getting any information from this individual where that plan might not work very well. And a lot of it stems from HMOs versus PPOs. I know specifically there's another company that does Medicare planning, and they put out there, here's the 4 or 5 plans we recommend. They picked one PPO from each company. Those plans aren't always the best for their clients because the costs, the benefits, and some of the insurance companies, they are not great when it comes to service and networks. But when you look up PPO plans, you know, in this search I did, it states that PPOs differ or offer more flexibility in choosing healthcare providers. Now, that's true. You don't have to go to in-network providers. And I'll give you an example of where a really strong company, some clients ran into an issue. You don't need to select a primary care physician or get referrals to see specialists. False and true. Again, you typically have to put a primary care physician down and declare who that is so you get the copay structures of the primary care. But you don't need referrals to see specialists. And that, again, typically is the same with the HMO. You can see any doctor, but you'll pay less if you use providers in the plan's network. Out-of-network care is also covered, but at higher costs. And that again is true. You typically see in those plans it will tell you in-network, and then you'll see what's OOP, which is out-of-network providers. So you'll see a higher copay structure there. It goes on, and some of the information that it's pulled in is that HMO plans typically have lower premiums and out-of-pocket costs. It's sometimes it's true, sometimes it's not. There's carriers in certain regions that only offer HMOs in one PPO. I've got the same carrier several counties over that all they have are PPOs, and those plans are cheaper and the benefits are better. It really depends on utilization and cost and profitability for those insurance companies in those areas. So it really varies geographically how those plans are structured. So that really, I'd have to say, is not mostly true. Co-payments for services are often fixed, which can make budgeting easier for HMO plans. They're fixed typically with PPOs as well. To trade off is a limited flexibility in provider choice. Now, again, that's not necessarily true because a lot of companies have nationwide networks. Whether it's an HMO or PPO, it's the same network. Now, here's where I've run into problems. I've seen doctors that with an insurance company's network doesn't take the HMO, but they take the PPO. That usually is an indication that something's going on. If it's a major insurance company in a certain geographical area, you got to ask yourself, why is that doctor no longer a network? I've seen this. I've seen doctors that have had malpractice, suits, lose their contract. They can still use PPO, but the clients will pay out of network. I've seen a lot of other reasons. Doctors dropping plans, they can still bill the PPO, but not the HMO. So if you're in an HMO plan that's out of network, you pay the full office visit. The PPO, at least you've got some structure there for it. So it goes on about the PPO plans, again, with higher premiums, higher out-of-pocket expenses, which is not true. The coordination of care. You look at, HMO plans, it says it emphasizes coordination of care through a primary care doctor. And this is where the referrals come into play. And I will tell you this, it's really difficult right now, I think, for a lot of people finding a good primary care physician and keeping that primary care physician. They move, they're not taking new patients. And I've got tons of clients that are looking and having to change for various reasons who their primary care doctor is. And some of them are just retiring out. With HMO plans and even the PPO plans, you look at them and they don't have referrals typically needed for specialists. And I've got so many clients that are involved with their health care that when they need to go see their specialist, they just go. They don't need to consult their primary care doctor, which a lot of times will just then quarterback it out. You can call, make an appointment if you need to see a cardiologist, dermatologist, whatever it may be. It's up to you to do that. So don't be afraid to take a little bit more control of your health care, and don't rely on your primary care doctor. If you can't get in to see that doctor right away, call a specialist, somebody that you think you need to see. So those are the big things when you go into which one's right for you, right? And I did a search on all of this, and and looked at AI, said what comes up. And again, generally a lot of these things aren't true. They talk about premiums, they talk about referrals, living in multiple locations. You just got to be careful, but don't have this preconceived notion that if you're an HMO plan, your primary care doctor is going to dictate and control who you get to see and be the gatekeepers for specialists. It's just generally not true. I want everybody to be informed on this, and just this information just keeps getting passed around. And again, when we look at the plans, the majority of them, that's not the case. And not to say that it might be the case with one insurance company in your area. And again, insurance companies are doing funny things now to restrict enrollments or to discourage people from enrollments, to decrease utilization of the plans in certain markets because it's based on profitability. And a lot of it's based on our government passing costs down to those insurance companies. So I hope you found this information helpful in helping you determine what is really the difference between HMO and PPO. And ultimate goal is really to help you figure out which plan is going to be best for you. Because there's a big difference if you come in with that preconceived notion, what's good and what's not good. In a lot of areas, all you have are HMOs. And again, no referrals are required. So it operates the same as a PPO in a given market if all those doctors that you see are networks. So hopefully you educate yourself, know your doctor's networks, and take a closer look at the plans. And hopefully everybody makes a great decision going into 2025. Thanks for joining me. Take care. Bye-bye.